As an organization psychologist and a researcher, this experience with the Culturally Competent Professional Practice Project has been illuminating in many ways. First, it has helped me to understand what a culturally competent professional is, what that person would do, what their competencies are. I think there are at least 4, or probably more than 4, but 4 that we have culled out in this project that are very specific to a culturally competent practice. The first is you have to understand and then use the cultural norms of the group of people that you're working with. The second is that any assessments, and for social work that would be safety and risk assessments, are strength-based, that they're grounded in what families do well. The third is that we utilize their families, extended families, kin, and community members as resources. And the fourth is that when we refer to service providers, whether they're mental health or parent educators or substance abuse therapists, that they be culturally competent.
So what we've learned at the University of Washington at the Northwest Institute for Children and Families about working with community partners, in particular as it relates to disproportionality, is that we've had to look at 3 different ways in how we approach the work that we're doing with this project. The first is that we had to walk our talk. We talked about giving money to folks so that they could find out how to better engage children and families, and we weren't walking our talk about how we were engaging our partners. So we had a couple of trials where we really didn't walk our talk and learned. The second one was that we had to support the leaders of the initiative and not be the leaders of the initiative. So there are champions who have been doing this work for years and years and years, who believe in this work, and what we needed to do was support those leaders in continuing to lead the effort in their community. And that the third piece that we learned was that we really needed to be aware of the contextual factors that were in play, and to be respectful of those cultural things that were happening in the community that were impacting the project, and to be flexible about that. Not to think that everything was going to happen on our timeline, but that it was going to happen as it should, and it unfolds as it should, and it has unfolded beautifully.
As we examine the evidence, especially all of the national federal studies, we concluded from what we saw that African American families don't neglect or abuse any more than anybody else. And that all of the other indices that we've been using to define African Americans, not just in the child welfare system, but in this country, drugs, family composition, education and income and all of those things, didn't seem to really make a difference. What did seem to make a difference is that something peculiar was happening when the kids hit the door. They weren't referred at any greater rate, but those who came stuck. And they stayed, they came early, stayed late. They were the first in, last out. So for us, that was positive. It meant that we didn't have to go out and solve the drug problem or the poverty problem or the income problem, all of that. This appeared to be somewhat of a professional problem. And we can get our arms around that. It simply meant we had to think differently about what we do with children when they come to our door.
When you look at the number of African American children in foster care in Seattle-King County, we do not differ that much from the national population of children in foster care. African American children are overrepresented anywhere from 5 to 7 times the general population in foster care. And that is what we've been working on, is trying to lower that percentage of children coming into foster care, and certainly removing them out of foster care at a faster rate. Our process is different from other processes in that it starts at the very beginning. First of all, our primary goal is to maintain children within the family and provide those services there, and to utilize relatives to do that, and community shared decision-making early on, as early in the process as is possible. That is our goal. And to that end, our process is very different from other like offices.
We had a case in our CPS unit where the mother had lost, due to her substance abuse and chronic history hooking up in domestic violence relationships. She lost 3 kids, 3 children. She had her parental rights terminated on 3 kids. 7 years went by, and she had another baby. And when we had heard that she had a baby, the hospital made a referral. We went out and investigated. And we were, at first, pretty much were assuming that things were going to be just the way they were 7 years ago. And in this particular situation, the CPS worker went out. Mom did not test positive for drugs. The baby was healthy. The mom could have used some of our, we did put in some support systems, a home support specialist. We gave mom some referrals, and we kept the case open, but we didn't remove that child. It wasn't in that child's best interest to be removed from its mom. The mom had made some changes, some significant changes, and I think most of us think that, when you've had your parental rights terminated on 3 children, that 4th kid is probably, headed in the same direction. And I think that, we have to step back and take a look at, where people are, don't make assumptions, and, work with people where they are at that particular point in time. And that mother still has her, we closed our CPS case, and the last I heard, she's doing just fine.
Well, the impact is that, first, that families are strengthened in their communication with each other. And then you build a willingness of the family to go outside of itself, of the nuclear family, and bring in other family members that can support them. And it reduces the secrecy. And as you know, whenever we do anything that we don't think is right, we don't want anybody to know. And you certainly don't want to be embarrassed in front of your family. So it reduces that feeling of embarrassment, and it builds cohesiveness within a family unit so that they can ask for help. And then, of course, the more people that surround a child and love the child and embrace the family, the better things are for the family. And that includes the education. We have found that once the family really gets involved, that the kids' scholastic scores excel. And then as far as human services go, they become testimonials. They can become an advocate. They can get involved in the office as a volunteer so that they sit on our family teams, and they can be support to another parent that's going through a particular situation. So all kinds of things are possible. Once a family sees that you see them and you hear them, and that they're not different. They're just a family that needs support. And who doesn't when you get right down to it?
I think people around the United States will agree with me that when you can see this kind of interaction between a family member that is in the system because of an allegation against that family member, and the worker that maybe brought about that investigation, that you can see them come together and support each other and see that worker really hear and understand, and sometimes even interpret to the team what the family member is saying, then you know that a change has been made.
We have a lot of work to do around understanding why African American children are overrepresented in the system. We know that decision bias is a key factor. And the 4 components of the culturally competent professional practice model begin to give us windows into answering those questions.